Good afternoon, everyone. Good afternoon to residents of Montgomery County. Before I give updates on the most recent patient count, I want to take advantage of this opportunity to thank all of the individuals who are working tirelessly on the front lines to make sure that they're doing everything that they can to keep the residents of the county safe. So to those who are working, thank you. We sincerely appreciate it, and those efforts will continue. Also want to take the moment and opportunity to express condolences to the families of the individual who passed away and to all of the individuals who have received diagnoses and have been impacted by this virus. Additionally, want to again take space for those who have anxiety and concerns, and rest assured that we continue to do everything we can to make sure that we're taking the necessary precautions and putting in the necessary measures to address your concerns and keep you safe. So for those of you who are following the case count, overnight this morning it was released that there are 149 individuals and residents of the state of Maryland who have tested positive for COVID-19. 51 of those residents are Montgomery County residents. That is an increase from 33 the day before. And so what I want to do is to level set and break down some understanding of what those numbers mean. If you think back to our early conversations, we talked about how there were going to be 4 factors to determine how we change what we do. So the first one was, do we see an increase in the number of suspicious cases in our jurisdiction, which we have. The second was, do we see an increase in the number of cases in our jurisdiction, which we have. The third component was, do we see a difference in terms of how it is being transmitted and across the state in terms of travel related or person-to-person contact related to those exposures or community transmission. And based upon the evidence that we have seen across the state and across the country, we are seeing an increase in community-related cases. The fourth component, and I want to come back and revisit the community piece, the fourth component was also seeing if there's any change in the severity of the disease within our communities. I'm happy to say, or optimistic to report, that of those 149 individuals who have tested positive for COVID-19, 15 have been hospitalized at this point. So that means, again, the overwhelming majority of individuals who have tested positive are convalescing at home with mild to moderate symptoms. That is, again, not to say that an individual can test positive and have more severe symptoms, but as it stands right now, our disease picture is consistent with what we've seen in other areas and other parts of the country. Now, to take a step back and go back to this concept of community transmission, what does that mean? As we explained before, that means that an individual can test positive without any known travel history or any known exposure to someone with a travel history. And that underscores why over the last week, our jurisdiction, in addition to the state, in addition to pretty much most of the other jurisdictions across the country, have implemented very strict guidelines restricting exposures to individuals. This is why we continue to preach social distancing. This is why we all are standing up here 6 feet apart to emphasize this message at home. I want to be very clear, social distancing means not congregating on basketball courts for young kids, not congregating in malls, not having large group gatherings at beaches or bars or things like that. It is essential that we adhere to those directives because those are the steps that are going to help alleviate the burden of community transmission and ultimately alleviate numbers of new cases coming in the future. We're likely to see the number of cases increase because another component of this, we are able to test more people, or more people are getting tested through private labs. So we expect as more people are getting tested, we're going to see more cases. I just want to remind you, though, of the criteria that we're looking at to determine how we shift and change our actions. And we're constantly monitoring the new cases as they come in to see if we can depict any type of trend or any type of significant contact exposure that we need to be extra precautious about in order to enact any further guidelines or directives to alleviate the burden of transmission. The last thing I want to say, and I'm sure we'll have opportunity for questions, again, is to emphasize to those at home, social distancing matters. Continue to take those necessary precautions, because even if you are not exhibiting symptoms or feeling fine, these steps are put into place to provide extra protection for those who are vulnerable in our society, whether that's by age or underlying medical conditions. Thank you.